Hello, everyone, and welcome to Step It Up with Dr. A, where we share stories, lessons, and insights to help students, professionals, and lifelong learners navigate their personal and professional journeys. Before we begin, I'd like to share a quick note. The purpose of this podcast is to educate, inspire, and encourage thoughtful decision making. The experiences, opinions, and perspectives shared by me and any guest are based on our personal and professional experiences and are intended for educational and informational purposes only. They are not intended to serve as individualized medical, financial, or professional advice, career counseling, legal advice, or academic guidance. Every person's journey is unique. My hope is that these conversations help you ask better questions, explore possibilities, and make informed decisions that are right for you. Please seek guidance from qualified professionals and mentors when making important decisions. Welcome back to Step It Up with Dr. A. I am Dr. Nivedita Agarwal, and in our last episode, we talked about finding your why and the importance of having clarity before committing to a career in medicine. Today, we are going to explore the next question every aspiring physician should ask. What does a doctor's life really look like? Many students are drawn to medicine because of what they see on television, social media, or during brief visits to a doctor's office. Television often shows dramatic, life-saving moments. Social media often highlights achievements, awards, and success stories. But the reality of medicine is much more nuanced. It is rewarding, meaningful, intellectually stimulating, and deeply human. It can also be emotionally challenging, unpredictable, and sometimes frustrating. Today's goal is not to convince you to pursue medicine. My goal is to help you see the profession more clearly, because informed decisions are always better than idealized ones. Growing up, I saw medicine through my father's eyes. As I became a physician myself, I realized that medicine is both more challenging and more rewarding than I imagined. There are moments when you feel like you have truly changed someone's life. There are moments when patients and families express gratitude that you'll remember forever. There are also moments when you leave work wondering whether you did enough. The truth is that medicine exists in both spaces. And understanding that reality is important for anyone considering this profession. So let me start by asking you a question. When you picture a physician, what do you see? Most students imagine doctors spending all day seeing patients. While that's certainly part of the job, medicine looks very different depending on the specialty. A primary care physician may spend the day helping patients prevent disease, managing chronic conditions, and building relationships that last for decades. A hospitalist may spend the day caring for acutely ill patients, coordinating with specialists, and having important conversations with families. A surgeon may spend hours in the operating room, requiring precision, focus, and technical expertise. A radiologist may spend much of the day interpreting imaging studies and helping clinicians make critical diagnoses. An emergency physician may walk into work not knowing whether the next patient will have a sore throat, a heart attack, or a life-threatening trauma. Academic physicians often balance patient care, research, teaching, and mentorship. The important takeaway is this: there isn't one version of being a physician. Medicine offers many different paths, personalities, lifestyles, and opportunities. Now let's talk about the parts of medicine that most people never see. Time pressure. Patient needs attention. Decisions often need to be made quickly. There are competing priorities throughout the day. Administrative responsibilities such as documentation, electronic medical records, insurance approvals, prior authorizations, paperwork. Many students are surprised to learn how much of modern medicine occurs outside the exam room. Emotional load. This is perhaps one of the most important realities. Physicians deliver difficult news, support families through uncertainty, witness suffering, navigate situations where there are no perfect answers. Some patients stay with you long after your shift ends. Some stories never leave you, and I'd like to share one of those stories. One of the lessons that medicine taught me very early in my training was that despite incredible advances in science and technology, we don't always have the answers. During my training years, I cared for an elderly gentleman who was found to have an abdominal mass that created significant diagnostic and treatment challenges, given the procedural and surgical risks associated. What I remember most was the frustration. As a student, I believed that with enough specialists, enough technology, and enough medical knowledge, we could solve any problem. Yet here was a patient who likely had a serious diagnosis, and despite the expertise of multiple teams, we could not move forward in the way he hoped. Ultimately, the patient was discharged home with close outpatient follow-up, while we continued to search for the safest path forward. I remember feeling helpless. I remember wanting there to be a clear answer, but there wasn't. That experience taught me something that no textbook could teach. Medicine is not always about fixing a problem. Sometimes medicine is about navigating uncertainty. Sometimes it's about balancing risks and benefits. Sometimes it's about patience, helping them move forward when there are no easy answers. And sometimes the most difficult part of being a physician is accepting the limits of what we can do. That experience challenged the idealized version of medicine I had carried as a student. It taught me humility. It taught me resilience. And surprisingly, it strengthened my commitment to medicine because I realized that patients don't need perfection. They need physicians who are willing to walk beside them through uncertainty. So at this point, you might be wondering, if medicine is so challenging, why do physicians continue doing it? The answer is simple. Because there are moments unlike anything else. Helping someone understand a frightening diagnosis, seeing a patient regain their health, supporting a family during a vulnerable time, watching someone achieve a goal they once thought was impossible, building relationships with patients over years and sometimes decades. Medicine allows you to be present during some of the most meaningful moments in another person's life. That is an incredible privilege. And for many physicians, those moments make the challenges worthwhile. Students today hear a lot about physician burnout, and burnout is real. It can result from heavy workloads, administrative burden, loss of autonomy, and emotional exhaustion. But burnout is not the entire story. There is another side that often gets overlooked, and that is purpose. Purpose doesn't eliminate stress. Purpose doesn't make difficult days disappear. But purpose helps you navigate those days. It reminds you why you chose this profession in the first place. The most fulfilled physicians I have met are not those who never experience challenges. They're the ones who remain connected to their purpose despite those challenges. Medicine can be difficult. Medicine can be meaningful. And both statements can be true at the same time. So as you think about your future, ask yourself, how do I respond to uncertainty? Can I handle situations where there may not be a perfect answer? Do I enjoy helping people during difficult moments? Am I comfortable being a lifelong learner? What aspects of medicine appeal to me most? Which physician lifestyles align with my personality and goals? An exercise that I want you to work with this week is I encourage you to speak with a physician. Ask them what surprised you most about medicine. What has been the most rewarding part? What has been the most challenging part? Would you choose medicine again? What advice would you give your younger self? And listen carefully. You may find that the answers are different from what you expected. And that's exactly the point. Medicine is not perfect. It is demanding. It is complex and sometimes frustrating, often inspiring, and occasionally extraordinary. The goal of today's episode wasn't to convince you to become a physician. It was to help you understand the profession more honestly. Because the best career decisions are made when inspiration is balanced with reality. Thank you for joining me on Step It Up with Dr. A. In our next episode, we'll discuss, are you academically ready? What it really takes to succeed as a pre-med student. Until next time, keep learning, keep growing, keep stepping it up. I am Dr. A, and I'll see you next time. Thank you for listening to Step It Up with Dr. A. Remember, this podcast is designed to provide educational information and inspiration, not individualized professional advice. Always consult qualified professionals regarding your specific circumstances.